All right, give me 1 second to share this video out, and we will be getting started. I want to talk about healthcare and what healthcare was meant for and what it's turned into and how we can make it better and all of that great stuff, right? Got some really cool stuff to share with you today. Let's see here. Share to a page. This is how we do this. How are you? It's a beautiful, beautiful day. And then let's do one more share and we'll be ready to go. Hey Karen, hello. I'm trying to get this shared out. And then I'll be ready to go. Okay, there we go. We are live. I think we have lights. We have no shadows. Hopefully it's crazy. So today I've been reading, I actually just finished this great book. It's Unconventional Medicine by Dr. Chris Kresser. And I want to read you part of the book because I want to have a kind of a discussion and a talk. And I know that's crazy to think that you can have a talk through Facebook Live, but you can because you guys can comment and I can comment back and we can have a whole discussion. Hey, Megan. So I'm going to read you an excerpt from Unconventional Medicine, which really hit home for me and got me thinking. And then I was on a coaching call last night with a client, and I had like another epiphany. And I was like, oh my gosh. And so I want to share that with you guys, okay? So in here it says, making small tweaks to our current system, meaning our healthcare system, and expecting that to work is like rearranging the deck furniture on the Titanic as it sinks into the ocean. It's too little and too late. And I know there's a lot with tax bills and healthcare reform and Medicaid and Medicare and all that going on right now. And it is truthful that the state that we are in the U.S., we have 1 in 4 people with a chronic disease. We have, within those, there's multiple people that have up to 4 chronic diseases. And the cost of medical and the amount that we spend on our health care and our insurance just keeps going up and going up and going up and going up. And personally, at one point, we owed $680,000 in just medical bills to North Shore. So I've been there. I know what that's like. And later on, I will actually post pictures. I took a screenshot because we have moved to a new way of doing health in our family. We're using lifestyle and we're using food and we're using holistic nutrition. And 2017, my out-of-pocket was $256. Not hundreds of thousands of dollars like it had been in the past. And that's even with the 3 girls and Will. So huge difference in cost. But Dr. Kresser goes on to say, if chronic disease continues to grow at the current pace, an insurance-based healthcare system is destined to fail. There's no way to effectively pay for the care needed in this country and this large, with 1 in 2 adults and 1 in 4 children having a chronic disease. And that's kind of a secret that nobody really wants to talk about. It's not really a secret. If you actually look at the numbers, then it's the truth. And nobody wants to think about that. Like, what happens when the money runs out? How do you get your meds? What happens when the money runs out and you need, acute care? Or what happens when the money runs out and you just have joint inflammation or you just feel bad, right? We've come to this equation, at least in the U.S., where health and healthcare, they kind of go together and they think that they're the same. But in reality, healthcare and health are totally separate. Them being related, yes. Them being exactly the same thing, no. You can have health without government health care or without, health care in general. Dr. Kresser goes on to say, along the same lines, health insurance isn't health care. Health insurance is a method for paying for health care, right? And although this is one of the most familiar, but it's relatively new. Did you know that in the U.S., private group insurance didn't even exist until 1929? And then it was after World War II in the mid-50s where corporations and employers started offering insurance to their employees because they found that they could get tax benefits. And that is why they started doing it. So prior to that, think about it for a second. Most of our grandparents were born prior to 1950. Most of our grandparents were probably born 1920 or earlier. And they didn't have private health insurance. They probably didn't have health insurance. So how did those people live to be 101, 102? I've seen recently a couple of ladies that I know who are, whose grandparents are celebrating their 103rd birthday this year. How did they live to be that way if they didn't have insurance? How did they live to be that way without health care and, and all that new stuff? In short, a minor tax benefit, that's what I was just saying, was passed a half a century ago. And that is what is our current state of health care. We rely on insurance, so much so that we rely on medications, we rely on the doctor. When, in all honesty, if you sit with yourself, this is one of those tenets I was talking about, and you actually listen to your body, you know what's going on. Your body will tell you what doesn't feel good. And if you go back to Mother Nature, you're going to find a way to heal yourself. Now don't get me wrong, if you're bleeding and you need stitches or you've broken a bone, yes, you need acute care. You need to go to the emergency room. If your foot hurts or you're gassy or you're bloated or you got acid reflux going on, you don't need a Marilax. You don't need an antacid. You need to look at what you're putting in your body and what's around you and your stress levels before you put some pill inside your body, okay? There's a better way. And I love that he talks about a better way. He talks about chronic disease being an epidemic, and it's a misguided and short-sighted epidemic, because mandating that all doctor's appointments are 12 minutes or less is not helping us. Mandating that, doctors don't get bonuses unless so many percentages of their clients are on pharmaceuticals is not helping us. Those mandates are not helping us in our health at all. Did you know that today we spend 86% of our healthcare dollars in the U.S. on treating chronic disease? Do you guys also know that chronic disease is the third leading cause of death in the U.S.? Now, what are we doing to fix that? We're really not doing a whole lot of stuff. I mean, some of us, yes, are helping educate. Some of us are going back and thinking about, what if I went paleo? What if I went to keto? What if I, went vegan? And you're starting to think about it, but you're starting to think about it because you've got to find a better way, right? And finding that better way is what's huge. That's when change happens. Right? Change happens when you're searching and you actually start to try something different, and that something different actually works. That's when change happens. So Dr. Krusser's calling it resistance to revolution. And he says, this is a quote from Arthur Schopenhauer. All truth passes through 3 stages. And you could look at our current situation in healthcare and insurance and everything that we're going through right now, and you'll actually see these 3 stages. First, it's ridiculed. People think you're crazy. They call you a woo-woo doctor. I actually got called a witch doctor on Christmas. It was joking, but subconsciously I'm like, that's what you really think of me. I see. Second, it's violently opposed. They're going to pass laws, regulations. They're going to do what Carnegie did back at the turn of the century and close all the holistic medical schools and went the pharmaceutical route. Third, it's finally accepted. But it's accepted after it's being self-evident. It's becoming evident to the person. It's evident to the self-being, right? And that's one of the things that Cleveland Clinic right now is going through. Cleveland Clinic in 2015 opened functional medicine. Functional medicine, if you don't know, is a way to look at the whole body, looking at the body as a functioning system and knowing that the systems work together, okay? But Cleveland Clinic opened a functional medicine practice in 2015. They hired Dr. Mark Hyman as their director. And they now are serving thousands of patients. They've expanded to a 17,000 square foot facility. And they're finding that the evidence is there, that it's working. It's working because they're spending time with their patients. They're spending time to listen. They're spending time to hear the whole story, to look at the whole picture, to look at the triggers. They're spending time to actually understand what the patient wants to focus on, right? And so when I say that I want to explore this with you, and when I was talking about how I kind of had an epiphany when I was on a phone last night with one of my clients, is she said I need to do an adrenal reset. And I said, okay, when are you going to do it? Right? Because she acknowledged she needed to take action. She knew what she wanted to do. She said, I'm going to start January 2nd. And I said, what do you need from me to help you and hold you accountable? Because that's my role. And she said, can you do it with me? And I said, yeah, but I can do you one better. I can get a group of people to do an adrenal reset with us, right? So everybody that's in our Healing Through Food community, if you would like to join us and do an adrenal reset, which is a 1-week food-based plan, there is a certain order to which you eat foods, and there's certain foods that you eat during that week, and there's things that you just don't eat. But if you're willing, Karen, thanks for the hearts, if you're willing to do that adrenal reset with us starting January 2nd, I know that's like next week, but it is after the new year. I want you to, like, in the comments below this video, just type adrenal. And what I'm going to do is I'm going to send you the meal plan for the adrenal reset. I'm going to send you a grocery list for the adrenal reset. And I'm going to send you an FAQ, frequently asked questions. Because if you've never done it, it is not a complete detox. You're not going to juice all your meals. All right? You are going to do some juicing, but you can do that in a high-speed blender. You don't have to have a juicer. Don't feel like you're going to go out and buy like any expensive appliances. If you're looking for an excuse to go get something, then it might be your excuse, but don't feel like you have to do that. What I want you to know is I'm going to be your coach for the Adrenal Reset Week, okay? And what does that mean? That means that I'm going to do it with you, right? The other thing you're going to do is I'm not just going to tell you what to do. I'm going to help show you what to do. I'm going to shoot the videos. We'll share them in the group. I'll show you how I make the juice. I'll show you some of the meals. I'll actually shoot some videos in our kitchen and put the tripod upstairs. And we'll motivate each other. We'll each help each other find our intrinsic motivation. And maybe that motivation is just having a community doing it with you. And maybe that motivation is seeing somebody else succeed, which is a great motivator of mine. Maybe that motivation is helping somebody succeed, and you're the motivator for them. And that's also uplifting for people and inspiring. It's a 1 week, so it's 5 days. You can expect coming out of the 5 days to have a little bit more energy. You can expect your bloat to be gone. You can expect, if you've got chronic headaches, for them to be a little bit better. I'm not going to tell you that you're going to lose weight. I'm not going to tell you that you're going to cure yourself. I'm going to tell you you're going to feel better. You're going to have some more energy, and you're going to give your body that reset you need to move in to the new year and to be able to take a hold of something, a different lifestyle change, and actually live through it and live with it. And if you actually find that you love the reset and you love the interaction, then at the end of the week, we'll invite you to join our group coaching program. Our group coaching program is amazing. But I want you to try it, and we're going to give you that as a gift, right? That's a New Year's gift. If you say and you type adrenal in these comments, then we're going to get you that meal plan. We're going to get you that grocery list, and we're going to get you set up so that you can do it with us and you can succeed. It's that easy. I want you to know, too, that it is a very much a functional medicine approach. It is meals that you could eat if you were on a functional medicine elimination diet. The foods will be the same type of foods. It's very, very much colorful, right? Phytonutrients are important. There is coconut oil. There is healthy fats. If you are vegan like Karen is and you're plant-based, there's no reason to think you can't do this. Everything we do can be modified, completely modified. So you can do that as well. What else can I tell you? I'm actually really excited about the Adrenal Reset because I'm kind of getting tired of the same old meals. We keep having chili every week. I mean, yeah, it's great chili and it's really high in protein, but I'm excited to go and, eat some fresh green salads and some bok choy, and green juice is what I drink 5 days a week. Anyway, that's not a huge change for me. For some of you, the green juice will be like, oh, I got to get used to this. And your taste buds are going to have to get used to it. But it'll be super, super fun. And then I've got some translating to do, I know, on some of these because they're coming across in Israeli or in Hebrew. So I will translate those and comment back. Okay, so we're going to start January 2nd. You got to comment below to get the menus and the meal plans, and I will definitely private message you those. And then the other thing is every day we'll be in the kitchen together. We'll make this happen. And don't forget the delicious the meals are. Yes, the meals are delicious. The meals are delicious because it's real food. There's nothing processed about it. There's nothing crazy. It's just real food. And when you eat real food and your body gets what it needs. Not only does it get you good energy and good cell structures, but it gets you to where you taste flavors. So with that, that is my big announcement. That's what we're going to do. January 2nd, we're going to start. Excuse me. I will get some more information up for you. But I want you to really think about healthcare as you go into 2018. And when you look at 2017, what did it cost you? What did it honestly cost you? Like I said, it cost our family $256 out of pocket, which was nothing compared to the over $500,000 we owed less than 7 years ago in just my own health expenses. And that $256 was healthcare for my family of 5. But that's, doing what you need to do and not relying on pills and all this other crazy stuff, right? It's relying on holistic stuff. So if you want to talk more about that, let me know. If anybody is interested in coaching moving into the new year, let's talk. But I would encourage you to do the Adrenal Reset with us. Give it a try, right? Try it before you buy it. Take it for a test drive. Have a little fun. And I will talk to you all soon. Thank you for joining me, and we'll talk later.